Clinical practice guidelines present opportunities for the Canadian healthcare system, even if some challenges remain. How can CPGs have a greater impact on quality of care and healthcare system performance?
Canada has been at the forefront of promoting evidence-based medicine, trying to make sure that patient care is based upon the best evidence that we have to improve patient outcomes in healthcare systems. And that's been a huge contribution that Canada has made to the world. Frustratingly, I don't think the Canadian healthcare system has got the best benefit out of evidence-based medicine.
So where should we be focusing our efforts to realize the benefits of CPGs? One area of focus is the use of CPGs for patients with more than one disease or multimorbidities.
On parle plus de 2 maladies chroniques. Il n'est pas rare en soins de première ligne de rencontrer des patients qui vont présenter 5, 6, 7 ou même 8 conditions médicales chroniques ou maladies chroniques en même temps. Alors, c'est à ça à quoi on réfère quand on parle de multimorbidité.
There's a lack of research and evidence on the care of patients with multimorbidities, posing a challenge for both the developers and the users of guidelines.
Writing clinical practice guidelines, and I have been involved in that, is not an easy process to start with. But it's a lot easier to write a clinical practice guideline about a condition like diabetes or coronary artery disease than it is to write a clinical practice guideline about a senior citizen with diabetes, coronary artery disease, high blood pressure, kidney problems, and on.
Je me suis intéressé à la multimorbidité dans mes recherches, probablement parce que j'étais un peu frustré de voir que la plupart de mes patients cumulaient des maladies chroniques et, traiter ces patients-là, ça se passait pas du tout comme c'est décrit dans les livres, dans les volumes, dans ce que j'ai appris, ou même dans les lignes directrices.
There's a recognized need to support research on CPGs that focus on multimorbidity care.
Il faut juste savoir qu'il y a maintenant un courant international de chercheurs qui s'intéressent à développer des recommandations pour les développeurs de lignes directrices, mais aussi pour les médecins qui ont à appliquer plusieurs lignes directrices. Alors, ça va être à suivre dans les prochaines années.
A second area of focus is the integration of CPGs into electronic clinical environments.
Healthcare is increasingly moving into an electronic era where electronic health records and other tools are being used to support practice.
Embedding guidelines in simplified, easy-to-read formats so that they can access them at the point of care when they're making decisions results in much better uptake of guidelines.
Clinical order sets are step-by-step checklists developed from CPGs and available at the bedside. Electronic tools like these can prompt providers about what care a patient should receive.
And those order sets are the most direct route I've ever seen for integrating clinical practice guidelines to the point of care. So, for example, we have pneumonia order sets. We went to the pneumonia guidelines, we wrote the order set, we reviewed it with our respirologists and general internal medicine doctors. Everybody agreed that this was the best way to write the order set, and now every person who admits a patient with pneumonia uses that order set.
So, are CPGs being followed? Do patients benefit? The collection and analysis of performance data is a third key opportunity for CPGs in the future.
We are always actually ongoingly looking at ways to learn from the field. The latest piece is that we actually also now are adding an evaluation component where organizations are providing the data and collecting the data to evaluate the impact of the implementation on nursing practice and on patient outcomes and on the organization itself.
It's very easy for us to say there's gaps in care, and people will sometimes listen to you. But what's really powerful is if you can actually measure the quality of care and provide very clear data-driven information regarding here's where the successes are and here's where the gaps are. It's really hard to refute, objective data that was measured.
Ultimately, patients should be the primary beneficiaries of CPGs. That's why patient engagement is a future focus.
When our hospital system and our medical system was built, it was directed at acute care, at acute infectious diseases to be specific. And when you have an acute infectious disease, you're taken care of by experts, people who know what to do. But the morbidity has shifted. So now most people suffer from chronic diseases, long-term chronic diseases that progress very slowly. And in order to deal with those, you have to have patient participation.
Dans l'élaboration d'un guide de pratique clinique, la participation des patients ou de représentants de patients à tout le processus est vitale, puisque le guide vise à les aider, de prendre leur perspective de quelles sont leurs préférences, quelles sont leurs valeurs, amène à faire des recommandations auxquelles ils sont plus susceptibles d'adhérer.
If we have more patient and family input, we would be able to have CPGs that are much more realistic and also would have better outcomes and result in better processes.
Collaboration and sharing of the collective expertise that already exists among Canadian healthcare leaders, researchers and clinicians is important to enhancing the impact of CPGs in the healthcare system.
Countries such as the UK, Australia, New Zealand have all invested in a national strategy for guideline development, dissemination, implementation. And we clearly see that in those countries, high-quality guidelines are produced and are more likely to influence practice and improve healthcare systems.
A national strategy for guideline development in Canada might allow us to tackle more proactively the burden of diseases that we see here by having a plan in place for which areas we're going to develop guidelines in, and in turn support the organizations that are going to develop those guidelines.
There are significant opportunities for CPGs in Canada. To ensure that CPG use provides the most benefit, coordination among all stakeholders is essential. The fact that Canada's provincial and territorial premiers have endorsed CPG use will go a long way in reaching this goal.
The conversations we're about to have are not going to be easy. There will have to be barriers that will have to be broken down. There will have to be some resources put into the development of national practice guidelines. And there will have to be some careful thought put into how we actually integrate the healthcare system so that it is the easy thing to do to follow a guideline.
To learn more about the Health Council of Canada's video series on CPGs, visit healthcouncilcanada.ca/CPG.